And we've had to do that because we have not had um, the cooperation we needed from enough citizens. And while many people are doing the right thing by staying at home and staying off the road, far too many people are endangering themselves and they're endangering this community. That includes our first responders, those people that our police chief, Ernest Finley, who's here behind me, helps to lead, as well as our medical care professionals who are on the front lines of this crisis. And so it impacts many more people than just those that may be suffering from some symptoms right now. It puts all of us at risk, and it puts this entire community at risk. And that's why we implemented a curfew last weekend, and we're seeing that gain a little bit of traction. But I think it's very important that this community know that's not the final step. It is one step in our enforcement effort. The curfew currently is from 10 p.m. to 5 a.m. It is a nightly curfew. Other cities have implemented daily curfews and 24-hour curfews. They have issued much stronger and stringent stay at home and shelter in place initiatives. We're looking at all of those options. We're looking at everything that we have to do to protect the public health and safety in this community. For instance, just last Wednesday, there were only 9 confirmed COVID-19 cases. This week, there are 31 in Montgomery County alone. That doesn't include one death that we've already had from COVID-19 virus. Last Wednesday, there were 242 cases statewide. Now, there are over 1,000 cases that have been confirmed COVID-19 cases statewide. So it's very important that we understand these numbers are growing, and they're going to continue to grow over the weeks and months ahead. And it's important, I think, for everyone in this community to do their part by being responsible and by being accountable. We're in this position together. We're going to have to get out of this position together. But we have to make sure that each one of us is doing everything we can to be responsible where this is concerned. There are going to be people that die in this community that don't have to die unless people start taking more accountability for their actions. There are going to be hundreds and thousands of lives lost if we don't see a different change among those who are living in this community and those who are working here. We have to do better because many of the lives that we're talking about are people who do not have to die if they would only be accountable for their actions. These are people who may infect someone else unknowingly because they're having a block party. They may infect someone else because they're having a neighborhood party, or because they're in a gathering of people where they should not be, or certainly more than 10 people. We have to take this health crisis serious. It's why this city is under a state of emergency. It's why the governor has asked that all non-essential businesses be closed. It's why we're looking at other forms of restrictions in our movement of people in this community to mitigate the spread of this virus. We have to do better, or else people are going to die, and we're going to have a lot more hurt and pain in this community than we otherwise should have. If we do our part, then we can minimize that. Only if we do our part by making sure that we understand the gravity of this issue that we have. And that's incumbent upon every individual that lives in this community, every individual that works in this community, and every individual that is watching or listening to the message that we'll be bringing here today. It does not matter if you're showing symptoms now. It does not matter if you know someone who has tested positive for the COVID-19 virus. It's no different than a gun. You know a gun can kill you because of the bullets that it has. Well, we know this virus can kill you because it is 10 times worse than the flu, and is an infectious virus that we do not have adequate treatment for, nor a vaccine. It is no different. And we have to treat it as such and take the precautionary measures that are needed to save lives in this community. And that's why everyone that is with us here today is joined together to come up with best practices and approaches of what we can do to make sure we keep this community as healthy as possible and we keep this community as safe as possible. But it's going to take more than just us talking. It's going to take more than just a few people listening. It's going to take this community rallying together to do what's needed over the next few weeks and months to stay at home and to stop the spread of one of the worst viruses this country has ever seen. With that, I want to ask Montgomery County Commission Chairman Elton Dean to please come up and give some remarks as well.
Thank you, Mr. Mayor. I'm here just to say that we are, the city and the county and the city of Pike Road are going to be walking hand in hand, working hand in hand as partners. Like the mayor said, this is a very dangerous disease, and we encourage people to stay at home, we see a lot of traffic in and out, and the sheriff and the police department, they're going to have their hands full trying to monitor this. People ask, how are you going to monitor it? Well, we got the police forces, we got the sheriff department to do the things that they're supposed to do. And I want people to understand the sheriff department and the police, the first responders, what they're up against. You know, oftentimes we watch CNN and see what's happening in New York and Chicago and all those places. Well, we're about to incur that kind of action also here in Montgomery. And one of the things that I want to do, and I talked to the mayor about also, I want to get our preachers involved, because the preachers are in the pulpit. They talk to their parishioners every Sunday. But now I want to get them involved every day, because we got a lot of people, even preachers, still trying to have church. And so we got to stop all of that. So I want to get the preachers involved and let them know that we need them to work along with the sheriff department, the mayors of these cities, the county commission, to make sure that we can keep these people off the street. And we just got a lot of work to do. I am so afraid that we don't understand, the people in Montgomery don't understand what we're up against. But we're working with the mayor of Pike Road and working with the mayor of Montgomery as far as the curfew and all of that concern. So thank you, Mr. Mayor.
At this time, I want to ask Mayor Gordon Stone of the town of Pike Road to come up and please give some remarks as well. Thank you.
You know, it doesn't matter how large your community is. It really matters what kind of decisions the people of your community make. And that's why we're here today. Whether you look at the statistics in your neighborhood and say, well, most of my neighbors are maintaining the social distancing and most of my neighbors are doing the cleanliness recommendations, that's great. And I think all three of us today, which I would say I'm very proud to be here with Mayor Reed, and thank you for your leadership, and Chairman Dean, thank you for your leadership. But all three of us would agree that there are a lot of people who are doing the right thing. But this is not about trying to protect those that are doing the right thing. Today's comments are really about trying to recommend that all people do the right thing. It is critical as we look forward and we want to talk about getting back to normalcy. We want to look forward to the day that our businesses are back functioning as efficiently and effectively as they were a month ago. When we think about those things, we must all make good decisions on a daily basis. That's what today's discussion is about. If you are out there and you're contemplating what to do, take the conservative approach. Take the approach that's going to provide safety for yourself, safety for your family, safety for your friends, and safety for others. If you don't do this now, then please make it part of your routine to observe what has happened in those places where this has not been practiced with great care. You know, Pike Road's a little different than the city of Montgomery, and I respect with everything what the mayor has to deal with here, Mayor Reed, and your larger city with multiple different dimensions. We don't have a curfew at this point in Pike Road. But we are committed, just as Mayor Reed is and just as Commissioner Dean is, to doing everything we can do to make sure people are making great decisions. So be smart, be safe, and if you do those things, you can have the confidence we'll get through it. So I want to say thank you to my colleagues. Thank you for your hard work. Thank you for this team we've put together. It's a pleasure to work with folks who are committed to making a positive difference for the citizens of our community.
At this time, I want to ask Dr. David Thrasher to come and bring some remarks. He is a former Montgomery County coroner. He's a critical care physician. He's a former director of respiratory care at multiple hospitals, and a former chief of staff at Jackson Hospital, and a former member for Business Council of Alabama and Montgomery Area Chamber of Commerce. He's also an advisor to many statewide elected officials on this matter and many other health-related matters. At this time, I want to ask Dr. David Thrasher to please come and give some remarks about what this community is facing and what the challenge is that he sees that we're up against. And I think some of his information is going to be very pointed for many who may be watching, many who may be listening, and have not heard the medical side from a local medical expert like Dr. Thrasher. Dr. Thrasher.
Thank you, Mayor. Confucius said, to know the future, study the past. Just a few weeks ago, the first patient with COVID-19 came to Montgomery. It was the first case in Alabama. Ironically, that was the day that the World Health Organization declared this a worldwide pandemic. Ironically, it was 102 years, almost to the day, that a private walked into Fort Riley, Kansas, with a sore throat, fever, and feeling bad. By that day at noon, be 100 soldiers that was in the infirmary at Fort Riley, Kansas, with what we would eventually be called the Spanish flu. It should have been called the American flu or the Fort Riley, Kansas flu. But we were in a war then. The press was censored, and because of the war effort, they did not want to publish how many deaths were happening to the Spanish flu. Only Spain will allow their papers to give the facts, and that's why everybody thought more people died in Spain. Not true. The Spanish flu started in March, just like ours did. It swept over 100,000 deaths by summer. We were sending our boys overseas to fight in World War I. As they started coming back in the late summer and September, the second death wave happened. This was much more deadly than the first. Some cities did it different. Two mayors I'm going to tell you about. One did it right, one did it wrong. Philadelphia did it wrong. The mayor there did not listen to the medical community. They said, look, we're going to keep the schools open, we're going to keep business open, and we're going to have a big parade, a victory parade, he called it. Against everybody's advice, they had that because he said it's too economically important for us to cancel the parade. In 3 days, all 31 hospitals in Philadelphia were overwhelmed with the flu. Over 6,000 people died in 6 days. It went on to lose many, many, many thousands. St. Louis, on the other hand, the mayor listened to the medical community. He shut down the schools, shut down businesses, he closed the churches, made it against the law for more than 2 people to gather outside. They had much, much less fatalities. There would be another third wave that would also devastate America. At the end of between 1918 and 1919, 650,000 Americans would die. 50 million would die across the world. It's a real deal. And this virus is eerily much like that virus. Well, what do we do? What's happening right now? Well, the next 30 days are going to be really bad for America. The next 30 days are going to be really bad for Alabama, and I fear for Montgomery. Without getting too complicated, until you know somebody that's sick, you don't know anybody that's sick. But we're on the upward swing of this sigmoid curve, and it's growing exponentially. And we're fixing to have an explosion of cases. Now, by the end of when this virus is finally contained, we can have about 40 to 60% of the population possibly infected. What we can do, can't change that too much, but we can change how many people die. And you've all heard the flattening of the curve and what we need to do, and that's where we need your help. Every day, our police, our firemen, our nurses, our respiratory therapists, our lab technicians, our cleaning ladies are taking care of these sick people. They're putting their lives at risk. We need your help. I heard today from the mayor that there's still 4 churches in Montgomery that are having services on Sunday. I call myself a Christian. I think this is horrible. If you call yourself a Christian, you're supposed to love your fellow man and not be stupid. Close the churches and do it remotely. What can the people do? A lot of people are doing a lot. They're making the homemade masks. That's another story we'll talk about later. But a lot of people are doing the things they should, but a lot of people are not. We still see people gathering, and there's too many people gathering together for safety. Mayor Reed and the commissioner and Mayor Stone, they're doing a great job. They are our leaders. Dr. Williamson with the Hospital Association is doing a great job. Dr. Harris with the Alabama Department of Public Health is doing a great job. We need your help, because without your help, there are going to be a lot of people die. Some of you will die, and some of you will know people who die. Mr. Mayor.
Thank you, Dr. Thrasher. At this time, I want to ask Chief Finley to please bring some remarks regarding the curfew, as well as a couple of other issues that he may want to highlight as well. Chief.
Good afternoon. Thank you, Mr. Mayor. I think that it's important. The message is clear. We need to stay at home. We need to be safe. We need to keep our distance. But as we, the Montgomery Police Department, the men and women of the Montgomery Police Department, we're going to be out here each and every day to make sure that we monitor the businesses, the residential area, the apartment complex, the known areas of possible gathering, and also the parks. And I think that we have to be that forward leader out there just to keep the peace, so to speak. In terms of curfew, I think it's important that we out there each and every night. We have identified extra resources out there, senior officers and veteran officers out there that know how to talk to people, know how to develop a reason to make these stops in these communities and probable cause. We're just not going to randomly stop folks. We're going to have a reason to stop folks, but we also want to be in these communities to make sure that they are safe, in these business areas to make sure that they are safe, and also in these parking lots and these gas stations to encourage them to make the necessary stops and go straight home. We know that individuals are going to be on their way to work, emergency type situations, and so we understand that. But if we identify individuals or groups out there, we're going to engage them, and we want compliance. So whatever we do in our 24-hour operation, we're looking for compliance, and I think that's going to be the key. And the message is loud and clear of safety, self-isolation, and minimize your contact with others, minimize these non-essential errands that you make. So at this, that's what I have at this time.
I'm sorry, Mayor, just 2 other points I wanted to bring out. Why should you do this? Why is it important? If there's one person, maybe asymptomatic, may feel like having a little runny nose, cold, goes in his normal self, and for 30 days, he will infect 440 people. That's why it's so important. Now, well, I'm a teenager. It's not going to affect me. I'm a 40-year-old. It's not going to affect me. In this town, we have a neonate, an 80-year-old, a pregnant lady, and a bunch of young people on ventilators that's critically ill.
Chief, I want to thank you for the work that you're doing in this. I certainly want to thank all of our first responders, our sanitation workers, our healthcare professionals, everyone who's on the very front lines of this and dealing with this in a way that most of us are not. And I just want to conclude this briefing just by trying to bring home where the stakes are. The stakes are basically life and death. I don't know how to put it any more starkly than that. We're looking at potentially hundreds of thousands of Americans dying because of this virus. We're looking at thousands of Alabamians dying because of this virus. We have say-so in that. We have the ability to help increase or decrease what those numbers are based on our behavior. We have to make sure that we are not putting the health of others at risk because we're looking out for the wealth of ourselves. And that means doing things in a way that is responsible, even though you may not understand it, even though you may not have dealt with this before. This is something that is a life or death situation. It is a pandemic. It is a reason for us to be in a state of emergency in this city. It is a reason why many states have all but shut down their entire populaces for the next couple of months. We're in a place where in the city of Montgomery, we will be having discussions, and we will watch certainly the impact over the next few days and weeks. What does this community choose to do? How do we move and how do we deal with one another from the standpoint of, do we take this seriously, and are we willing to police our friends? Are we willing to help police our neighbors and our church members, and making sure, whether that be through a polite nudge or whether that be through an encouraging word, to let them know that some of the things that are still happening and going on should not be taking place. And that's not because of any other reason but for the fact they can be infecting people and not know it. They can be making someone sick and may not know it, and they can be putting themselves or others at risk of a deadly disease, one that we do not have a vaccine for, one that we are still dealing with various types of treatment on, and one with which our hospital system cannot sustain. And we have to make sure that we are addressing that in an urgent manner, no different than we would a tornado, because this is no different except for we can't see it. We can't see the clouds and we can't see the dust storm, but we know it's there. And we have to operate in that fashion to make sure we save lives. And the lives that you may cost may not be your own. It may be a family member. It may be a friend. It may be a neighbor. It may not be yours if we don't take the necessary steps in this city to do what we need to do, and that is to stay home as much as possible and to limit our contact with others as much as possible, and to make sure that when we are within a group that is no more than 10, and then we are ideally 6 feet apart. We have to make sure that we understand this for what it is, because it is something that this country has never seen before, and that is a 50-state natural disaster, and it is going to get worse before it gets better. We can come through this by working together, as we're doing here with my colleagues, Chief Finley, Chairman Dean, Mayor Stone, David Thrasher, and many others in the private sector, many others in the healthcare community, and many others who are doing the right thing throughout Montgomery and the River region. But we have to make sure that we don't fall into a false sense of security because our numbers are low. Our numbers are low, in my opinion, because we do not have enough test kits and we have not got enough people tested. And I certainly believe that if we were to test people at the same proportion that other communities have access, we would see similar sized populations. That's why we reached out to Hyundai to ask them to go to the South Korean government on our behalf to try to identify test kits. Upwards of 10,000 at least is what we asked for. That was a public-private partnership, and we've heard from Hyundai Motor Corporation, and they are looking at ways to try to get us an FDA-approved test kit. That is very important because we want people to know that if they have some of the symptoms, that they either have the virus or they don't. We want them to get the diagnosis, and we want to make sure people can then follow the necessary steps to self-quarantine and to make sure they don't spread this virus to other people. But we have to make sure, until we get the access that we need in our healthcare community, that we do our part. And I'm going to end with this. Where we are right now in our nightly curfew is to discourage public gatherings. It is to discourage social gatherings among people of all ages. That's just one step of many that we may have to take if we don't address this matter and we don't take accountability ourselves. And whether or not we have to go further with more stringent measures will depend much on what each and every individual that may hear this or may see this chooses to do. That comes back to each of us playing our role and playing a part in working together to flatten the curve and stop the spread of this virus, so that you or someone you know or someone that's connected to you is not a statistic, does not lose their life because of our inability to to follow a few instructions and to inconvenience ourselves for some weeks at a time and change our normal patterns, because that may come down to a life saved, and that's what this is all about. I want to thank you for being here today. I certainly want to thank all of our partners in this. We don't have all of the answers, we don't have all the ideas, and we welcome all of those from our leaders here, but many leaders that are in this community. And we're in this together, and we'll come out better and stronger on the other side of this. If you have any questions, I'll take those now. If you have any you'd like to address to any of the other colleagues, that's fine. Yes. I think it's not resonating because people don't see loved ones and neighbors dying right next to them. I think because they don't see what's going on in the hospitals, because they don't understand the impact that it's already having on our first responders. I think because they don't realize the risk that our policemen and our fire and rescue and our sanitation workers are dealing with in terms of what they do day in and day out to make this city and this county go. And I believe that's in part because there's a misnomer because of the numbers that they may hear that we're in a better place, or that's not going to happen here, or that could never be this community. Well, just ask the city of Albany, Georgia, from what happened by just a few people going to a funeral and how many deaths have related from that issue. And so unfortunately, there are some who are not going to understand this until they see or hear about someone they know dying from this virus. And unfortunately, I believe that's why the police department may have to make an example out of some who don't understand what's at stake here. And if that means a fine, if that means an arrest, then so be it. The curfew is there for a reason. And that's just one step in many that we may take going forward to protect the health and protect the health and safety of people that live here. And it goes much further than just the people who are hanging out or gathering to have cookouts or to have parties. Hey, we're all inconvenienced by this. The city and the county, we're losing revenue which funds our ability to function as a government, which impacts our ability to bring services to people in this community that need it and that want it and depend on it. The schools have been let out. So everyone has been inconvenienced by this. But unfortunately, there are a few, and I want to say a few, who still don't get the point. And that's why I've decided to not only implement the curfew, but in talking with Chief Finley to move from encouragement to enforcement. And that's where we are. We're going to enforce this curfew, and if that doesn't get enough people's attention, then we'll go to some stronger measures as well. But we have to make sure we are looking out for the most vulnerable in this community. We have to make sure we're looking out for people who are doing the right thing, but can still be infected by others who are not. And that includes businesses who are not observing the rule of having no more than 10 people inside. That includes businesses who are not observing the 6-foot rule. That includes organizations that are still meeting and grouping together when they should not be. So we have to do our part to, unfortunately, bring this home before it blows up in our face. And where we're headed right now is we're sitting on a ticking time bomb. And if we don't address this in a way and diffuse it, then we're going to have an explosion in this community that no one's prepared for and no one can handle. And we're going to ask the very few to go out and save the foolish of the many. And to me, that's not fair, and we're going to do everything in our power to prevent that. Well, you touched on one. Everybody that operates a business has to come before this council. And anyone who's not a partner with the people that you see standing behind me and many others that are in this community trying to fight this virus and do everything they can in the hospitals and on the front lines, then to me, maybe doesn't deserve to be in business. And so if a business is not smart enough to observe and understand where we are in this crisis at this moment, based on all the data, based on all the information, they probably shouldn't be in business, and that's something we may have to review when their license comes back up, or maybe we bring it back up to be suspended. I think certainly our police department can do whatever the chief charges them to do, and he's been given carte blanche to do whatever is necessary to make sure that the health and safety of the people of this community is number one priority. And whatever has to be done will be done. And so there may be some unprecedented steps that have been taken, but we're living in unprecedented times. Any other questions, ma'am? Sure.
I want to answer, Jen, your question, because I think for me, last Friday was a real significant day. Now, we're fortunate because we have a lot of information that's provided to us. But last Friday, I made a phone call to a work colleague only to discover that he was not only had been diagnosed to have COVID-19, but he's fighting it. And having that personal conversation and understanding the difficulty that he's going through as a young father of two, whose wife has also had medical problems earlier in her life, and how that is impacting his family, and how he's struggling daily to go through it. That makes it real. And I think that part of the challenge that Mayor Reed just reinforced is that people have not paid attention to the reality of some of the difficulty. And I would reiterate, there are plenty of stories out there. We need to make sure we aren't ignoring those stories of just how difficult it can be. That was a big day for me.
I've got 6 great colleagues who are taking care of these patients in the hospital. We're behind New York. We're behind them probably 2 or 3 weeks. That's why I said the next 30 days I think are going to be hell for America and hell for Alabama. I'll give you an example. I always tell about a fish pond. Everybody here knows what a fish pond is. So you put 1 lily pad in that fish pond. If that doubles every day, it doesn't consume the whole pond until day 60. Day 59, only half of that pond is full. Day 54, only 20%. We're at the 20%. We're going straight up. So this pond can be full of deaths and patients if we don't do something. That's why it's so important to do what Mayor Reed is telling us, to shelter down, stay away so we can keep those numbers down. It's going to spread through the community. We're going to have a lot of people here, but what we're trying to do is not overburden the ICUs, really not the hospitals. The ones that go in the hospital, most of them are going to end up on an intensive care unit, and a lot of them will be on ventilators. So we're not seeing the numbers yet, but again, we saw the first one in Alabama roughly three weeks ago, mid-March, and it's steadily going up. I chart that curve every morning from the U.S. as well as Alabama as well as Montgomery, and it's going straight up now. It's not even thinking about curving yet, and so it's not here yet to answer the question. No, we can make a difference here, okay? Mayor Reed has done a heck of a job, and that's one reason we're in better shape. Look at Auburn, right across the border. Mobile's fixed to get hit hard because of their interaction with New Orleans, I fear. Huntsville's getting hit pretty hard. People here are doing a better job, not a great job, but a better job, and I think we're behind some other cities. Auburn almost ran out of ventilators last Friday. We don't want that to happen here.
Any other questions? All right. Thank y'all so much for coming. Thanks for all the great work you're doing and getting the word out and trying to let everyone know exactly what we're dealing with. Really appreciate the work that you're doing, and really appreciate you all helping us with the megaphone to spread the word throughout this community and throughout this city. You've been a tremendous help. Thank you. Thanks for coming.